Welcome to the Diva T-Town. Welcome to the Diva T-Town, where bold, confident women embrace life unapologetically. From love and sex to wellness and reinvention, we keep it raw, real, and powerful. No filters, no limits. Just fearless conversations to help you thrive. Let's dive in with Diva Mia and Diva Cat.
Aloha, Diva Cat.
Hi, Diva Mia.
How are you today?
I'm good.
How are things going?
It's a little hectic today, but other than that, it's nice. The weather is nice.
It is nice. I love it when it's sunny outside.
Me too.
Well, you know what? Today we got another special guest.
I'm excited.
This special guest is really true to my heart. She's one of my great, amazing friends.
No, I can't wait to hear all about it.
She is a nurse for 20 years.
Oh, wow.
I know. So she's got a big heart because that takes a lot of work to be a nurse.
I don't know anybody who do that job for 20 years.
I know. It's a lot. And I think that because she was a nurse and she'd had some past traumas in her life,
Okay.
that she knew what to do when people needed help. One of the things that happens is nurses need help too. Nurses go through a lot of stress.
I think the nurse is the most stressed.
I think so too.
Have it in you to have that job.
You
I
know,
cannot do it.
They take abuse from the patients, but they also take abuse from the doctors and other people as well. So they've got a lot of stress and things that go on. And remember, COVID was crazy, right?
Yes.
So I think there might be a little bit of a mental health crisis in nursing, as well as you have nurses that need to be coached in order to continue in the field, in order to stay and change their mental capacities as well. So she started a coaching company, and it's called North Star Nurse Coaching. It is giving back to help nurses become vibrant and compassionate. It's helping people grow and thrive in the nursing community. And this coaching company, it just is really there, and it's a spiritual thing for nurses because they lose their way sometimes.
Sometimes, all the time.
And she helps them find their way back. And there's other struggles too. Sometimes there's legal issues in the nursing field that she helps people through. So she kind of does it all. So without further ado, I want to introduce Tammy. How you doing, Tammy?
Hey guys. Thank you for having me. I'm truly excited to be here.
Well, Diva Tammy, we are very honored to have you because I know you've got a super busy schedule and you're booked all the time. It's amazing what you do to help people. Can you kind of share a little bit more about what you do?
Yeah, so I'm still a nurse. I have been an ER nurse for over 20 years.
ER, not just regular nurse. God bless you. Wow.
ER nurse for over 20 years. And I also specialize in forensics. So I specialize in sexual assaults. And I've been doing that for about 17 years. So I have definitely pursued my passion with helping people, but I think it's just come to a head where I was burnout and I had compassion fatigue, and I recognized it and I didn't know what to do. I was very close to just quitting, throwing the towel in and walking away from the whole profession. But it took some soul searching, and I was able to come back to what drew me into it. And I've worked very hard the past few years to just get to where I'm at and kind of stay focused on pursuing my passion with helping people.
That's awesome.
Thank you.
The nurse, they got hit from every angle. You really have to have it in you to have that job.
So can you tell me what kind of triggered or led you down the path of becoming a coach? Because that is something that you have to step outside of who you are. And you already help people so much with nursing, but now you saw opportunity to help other nurses. Kind of what triggered that or led you down that path?
Yeah, that's a great story because it kind of just the way things align. So let me just start off by saying a majority of people in medical professions, especially like emergency first line responders, unbeknownst to them, or even if they do know it, we have some type of prior trauma in our lives that kind of led us to this path. And we become the people that we needed the most. So we already have this underlying kind of trauma, and we're drawn to a profession where we just kind of go for it and we're still head on in the trauma. And that just leaves you for a higher propensity of burnout. COVID hit. I was already at that cusp of being burnout. COVID hit, and it was a very surreal experience we're living through a pandemic. I went straight up to Boston to work. It's like my second home up there. I absolutely love Boston. I was there for 2 years at a level 1 trauma center and always have a place in my heart for Boston. But I went up there. I didn't want to be in the thick of it in New York, but I wanted to be able to help. Went up to Boston to help them with COVID. And that was eye-opening because it was a lot of academia. We were doing real-time practice as the pandemic's going. We're, like proning patients, the way we intubated patients, the different medicines we use, the different things that we tried to help with these patients, and seeing firsthand the amount of, I don't even know how to put it into words, but just seeing firsthand and being there and living it. We're already masters at compartmentalizing to begin with, and that was just another level of compartmentalizing. And I think eventually, when you had downtime in a pandemic and it's so quiet, I got to sit in stillness, and I think my compartments just burst. And I needed to sit and reevaluate. And that was the perfect time. People were home from work, people were with families. We saw things like people going back to basics of I remember this distinctly. How do you strip your laundry? Put some borax in with some vinegar. So people were going back to basics, the fundamentals of living, rather than depending on the convenience of life. And I was like, well, that's kind of a nice way of putting things. So COVID allowed me to kind of sit in stillness. I remember, again, it's a surreal experience. Literally got to sit with friends and coworkers that I worked with in Boston. And during COVID, people would have those safe distance meetups where you sit in the back of your car and you're like 6 feet apart. We literally had brought in like lawn chairs and sat on a wharf in Boston, like downtown. Nobody is around us. And I've got pictures where it's the middle of the day and there's nobody in the streets walking. And it was just a surreal experience. So we got to experience that like picnic together. And I just remember we had a lot of downtime. And when you would go out into nature, you'd go out in public, there's nobody around. So that stillness allowed me to sit and really reflect on what was important to me and what I was doing and kind of process what I was going through at that time in real time rather than shelving it for later. And that led me to do a lot of shadow work, which is like asking the tough questions and answering them, like getting really raw with yourself. I just happened to call a friend of mine who I had known for a decade and have a conversation. And we were just, catching up. How's it going? He's a nurse as well, been a nurse as long as I have. And we both were talking about how we just felt unfulfilled and how we noticed there's been a shift and a change in our career, the patients, healthcare, our lives, what we were doing at this point in our lives. And so just that conversation he and I had, very raw, very vulnerable, allowed me to open up even more. And then he sent me a book, and it's called The Burn Book. And it was even more shadow work that could be done.
Oh, wow.
So I did that book. And I remember very distinctly, I had just ended a contract. I was in North Carolina. I rented a cabin in the woods by myself and my cat in the woods, in nature, just by ourselves. I shut the phone off and I just answered every question in that book. And I got to go out and hike and sit in nature. And I think that week really helped me reset a lot of things. So that was kind of the turning point going forward. Yeah. So I think what happened is I got to sit back and look and say, these are common denominators. These are common patterns. A majority of nurses, especially air nurses or firefighters or policemen, we all have these common denominators and common patterns. So how can we break out of that? Because if you continue down this path, it's going to lead to this burnout. And so what do you do?
So you came up with a company named North Star. Is there some reason that you call it North Star?
Yes. And I realize it's a very long name for a company, but I have to say, when I was thinking about this company, North Star is something that is a constant. So when I was learning about coaching and holistic care, again, you notice patterns, and I kind of understand that healing is not linear. It is layered. So with that being said, I said, okay, how can I kind of simplify it? Because this is the way we are in our society. We just want to kind of simplify things. So
North Star's not that long.
Well, it's North Star Nurse Coaching is the name.
I
It's
need to
4
rebrand
words.
it.
So
No,
it'd
it's
be like
good.
NNC.
Well, one of the questions I have, is it only going to be for nursing, or are you going to expand it to some other?
It's basically for everybody, but this is something that I resonate with. Like, I have firsthand experience with this, and I'm like, okay, if I stayed in this path for over 20 years, how can I help the next generation so that they don't go the path I went down? Because it's very common for nurses to become alcoholics, to start diverting medications for numbing the pain, doing behaviors that are a little extreme and kind of dangerous to disassociate and numb the pain. And you'll see the patterns. You'll see like the extreme behaviors. And, I'm not proud of it. I used to go out and drink almost nightly and party and have fun, but it was also a way that you let off steam with your coworkers, and you just bonded, and it's a trauma bond. And once you recognize that, you're like, oh crap, how can I get through this? Because majority of behaviors are typically trauma bonds or trauma reactions. So then once you recognize that, then you can like kind of mitigate the.
It's funny you say about nurse. You'll be surprised. There's a lot of alcoholic doctors.
Yes.
Yeah. A lot of doctors that divert medications too.
Yeah. I think there's a lot of alcoholic people.
Yeah.
So you talk about kind of an evidence-based practice with mind-body healing, like you're looking at the whole person to help them heal when you coach. It's a type of life coaching to help a person grow and heal at the same time. So what are some of the tools that you do in a session?
We do a one-to-one typically, and I want to see where these people are. So it is customized one-to-one personalized nurse coaching. And the reason I put the nurse coaching is because we utilize the nursing aspect and the coaching aspect and putting it together, and it's a holistic type of process.
So do you use mindfulness or any type of relaxation techniques when you're coaching someone?
100%. Like we get to the meat and potatoes and we find out what exactly is the root cause of the overall. I'm not here to be your therapist. I'm here to be your coach. As long as we can recognize where the pattern kind of began, then we can start to work on mitigating the outcome. Again, typical trauma response. If you were a kid that was constantly berated and told, yelled at, or like you had overbearing parents that didn't allow you to speak, you become a people pleaser. You become quiet, and you become very empathetic to the fact that you can tell what's going on in a room because you have been quiet and you listen and you're watching for those cues so that you don't break the ice, so that you don't cause strife. So those are trauma responses. So you'll notice a lot of people, and typically nurses are very much, we take care of people, and
they just stay quiet. That's what I noticed.
Right. So they'll stay quiet and they watch the room, but they also are in tune to know what is going to happen next. And we were taught to anticipate what a doctor's going to need, because we need to prepare for the patient and also advocate for the patient. And it's a symbiotic, cohesive relationship with doctors and nurses and techs and the ancillary. Same with coaching. You're going to do that one-to-one assessment. You're going to see kind of where they're lacking or where they might need a boost of strengths and weaknesses, like a SWOT analysis. And then we're going to go from there and say, okay, so let's look at some evidence base. We're constantly in a sympathetic state of fight or flight. What if we need to get out of that and go to fawn or freeze, or even just out of it altogether into a parasympathetic, the natural rest state? A lot of us don't know how to do that. I can't tell you how many nurses are like, oh, I didn't do that on my day off because I can't rest. I just got to go. And I was that person. I never sat. I was always doing stuff. And the irony of it is, like, I'm a bigger girl. I'm heavy. I'd go to the gym, work out. I know my cortisol was way off the charts. I'd drink energy drinks. I think at one point when I worked in Boston, I was drinking like 3 large iced coffees plus a Monster per shift in their 12-hour shifts. And that's a lot of caffeine, right? So you just keep having caffeine and go. And also, it's instant gratification. So if I'm hungry, I'm going to eat. Don't worry about the repercussions for later. Unfortunately, that does catch up with you. So again, it's recognizing those patterns. So we're going to work on a lot of evidence-based, especially with the reset of this sympathetic response. So we're going to do some deep breathing. We're going to do some mindfulness. If we need to just, a lot of times at work too, we have so many new nurses, new generation. If they're spiraling and I can see it, I'm not going to inject myself into somebody just because. I let them come to me, but I let them know I'm there for them. So if I see them kind of spiraling, I'll say, hey, take a minute. Let's go outside and just get some fresh air. And I'll like put your hand over your heart and just take a deep breath. Just that couple deep breaths will help reset your vagus nerve. And that helps. A lot of times also, if you take a cold ice pack and put it to the inside of your arm or the back of your neck, that resets your vagus nerve as well. So those are little tips and tricks that we forsake because we got to keep going. I mean, I have a nurse I work with now who is a newer nurse, and I absolutely adore her. And she was having a rough time one day, and she was like, I can't stop. And I'm like, you can. And I literally had to pull her away and say, you have to stop now or else you're going to crash. And I said, I'm just going to say my piece. You can do it or not do it. And I think she ended up taking the second and walking away. But that's all it takes, someone to acknowledge that you're in the weeds or you're spiraling. We beat ourselves up over the littlest things like, oh, I should have caught that. Now he's, going to die or whatever. And it's unfortunate, but it happens. But we keep doing that, and keep going without resetting. So again, it just builds up, compartmentalizes, and all that energy is just stifled.
You mentioned SWOT technique or SWOT analysis. What is that?
Strengths, weaknesses, opportunities, threats. It's a business analysis. I highly recommend everyone do a SWOT analysis on themselves. I think the biggest thing is, for me, was to know thyself. So doing the shadow work helped to do that. I also encourage people, if you're really interested, to do the Myers-Briggs test to kind of get an idea of what kind of personality you are. And there's other different kind of personality tests out there. For me, personally, the Myers-Briggs has always been very consistent. I get the same thing every single time. If I do other personality tests, it depends on how I'm feeling that day, and my mood will vary the outcome. But Myers-Briggs has always been consistent for me. And having that, I'm like, okay, so it's facing the good, the bad, the ugly. So you're going to look at me like, oh man, I am kind of judgmental. Maybe I should work on that and be aware so that I don't do it as much, or I can say it differently so it doesn't come off as judgmental. So it's understanding that.
You've described some resiliency that nurses have to do. What do you do to work with nurses so that they can be coached into a way that can make them stronger for the days they have to be extremely resilient, especially after going through COVID?
I find that motivation really helps. It's kind of like a balance of helping to regulate the nervous system a little organically. And it's also motivation and inspiration. Coaching is not something that I'm going to thrust upon somebody and just do. They usually come to me because they're willing to do the work to do it. And so it's a beautiful relationship where I'm holding them accountable. They're holding me accountable, but I'm laying out these are the patterns I see. Do you agree or disagree? Let's work on it. What do you want to do to work on it? Here's our goals. Let's go for it. And that seems to help.
Excellent. Excellent. One of the things that I think nurses may have a difficulty time with, I know I have it myself, is setting boundaries, because I bet there are patients that you get attached to, and if something happens to them, I'm sure it's heart-wrenching. So how do you teach people to set better boundaries?
Oh, I suffer from this, and I still struggle with this daily. But to be fair, it is a practice. And I'm not even going to lie, I watched a lot of TED Talks and I listened to a lot of podcasts on how to script responses for boundaries. And I just practiced them. I know it sounds silly, but even affirmations, looking in the mirror and having affirmations and kind of running the script through your mind, that has helped me with the boundaries. And one of the things I was guilty of as well is oversharing or over-explaining. And I learned not to do that as well.
Don't get too attached. That's what they said.
And you can get somewhat attached. There's some patients you're really going to have this attachment with.
Yeah.
Even in the ear, it's a blink of an eye, but it'll happen. And there's been many parts, and there's been a few times in my career that have just left a lasting imprint my whole life. And they're very few and far between, but when they happen, they were needed at that time. And I will never forget the moments it happened because it really left an impact. And you just take it for what it is. And when it comes to the nurses with building boundaries, it's let's practice. Why are you hesitant to say no? Why do you feel obligated to work extra? Do you need the money? Let's figure out why you're doing this. You just hate yourself. Are you just that so committed to the trauma that you just want to be in the chaos the whole time. That's been a common answer too.
Yeah.
It's asking those questions that they're not ready to answer. And sometimes it just leaves that mark, just asking the question, it'll plant the seed.
Yeah.
And that helps. But it's going through the repetition of, hey, you can say no, and this is why you're going to say no, but you don't have to explain it to them. So,
do you find that the people that need your services are more new to nursing? Because I know nursing has changed a lot. So are they newer nurses, or and new nurses can get burned out as well.
Yeah.
Or are they, seasoned nurses that have been doing it for 20 or 30 years?
It's a mix of both. I have some newer nurses that are less than a year that have like, oh God, I need help. And I love that particular generation because they are a little more self-aware than we were at our age. So it's been great working with them. And then the more seasoned nurses that are kind of my generation, now there comes that pinnacle, like midlife, like what am I doing? So they have, it's a mix. The middle ground, not so much. I think they're in the middle of their career and they're just on their path. But it's usually 15 plus years and then 1 to 2 years. That's what I've been.
Nurses is amazing. From my personal experience, we have 4 nurses in our family. None of them passed that 5 years.
Really? They changed careers after 5 years?
Yeah.
Really?
My baby sister became a chef. And one of my cousin's wife, she became a personal trainer and she was on stage. She does not do nursing. She just.
But do you see the pattern? They're always something. They're helping other people. Like chef is cooking for people, providing nourishment. Personal trainers helping people.
Right.
So it's the same kind of pattern that we're drawn to this profession to help other people.
Yeah, and the other 2 become Botox injection and fillers work at the med spa.
So they're still kind of doing nursing.
They're still doing nurse work, but it's not the hospital work.
Yes.
Yeah, lots of overlap.
Is there a certain personality type that you think is better that will survive the nursing stresses?
It's funny because each discipline in nursing has kind of its own personality. Like I wouldn't expect an oncology nurse to come into the ER and work because ER is considered a little crazy and unhinged.
Yeah.
And ICU is more structured type A. Things are lined up, and where ER is like, if you have a cord and you wrap it around the way it's supposed to be, that's IC, and ER just kind of jumbles it and throws it.
Yeah.
That's the ER. So we all have different personalities.
Yeah. My sister's was delivery nurse.
Yeah.
The baby come out, no breathing. That was the last drawn for her.
Yeah. I personally am not drawn to labor and delivery. That is something I didn't want to do.
She was like, that was the end.
Yeah.
Yeah, she couldn't do it.
Yeah. Those add up to, and maybe a dozen deliveries in my 20 years in the ER.
So I think what you're doing is very great for the nurses, and someone should reach out to you. Maybe you could coach them through. You know what I mean? So what you use, you have your training modules, when you meet with them one-on-one, and you break it down as a module, step 1, step 2, step 3, step 5.
Yeah, we'll devise plan together. So it's like a 1-to-1 session to kind of see where the issues may lie or what the concerns may be. And then we come up with a collaborative plan together, and I make some suggestions. They say yes or no. I do have a few certificates in trauma-informed care as well. I'm a CISM provider, which is certified incident stress management. And so that's just like if we have a demise, if we have a traumatic event in-house in the emergency room or with our colleagues like firefighter and police, I'm certified to do a debriefing with them.
So if somebody died,
correct,
you would be able to help debrief the nurse.
Yes.
That is incredibly stressful. Just especially with the pregnancy deliverer, the deaths there, the new babies, but also especially if you got attached to someone and then they die. That's under your care.
That's another thing. My mom's in nursing home right now, and this lady, all the nurses, they've been working with this lady for the past 10, 15 years, day in, day out, more than the kids. What if something happened to them? Then what?
Yeah.
So your nurse is like, you help them to reconnect with themselves?
Yes. I found that I was so immersed with my job. I married my job very early, and I became like this uber super ER nurse. Yeah. My identity was melded into this. There was no separation between myself and my identity as a nurse. And it's much like, here's an example. Like if you have a patient and you're like, okay, you're diagnosed with high blood pressure and diabetes and fibromyalgia, you can talk to the patient and say, hey, what's going on today? well, I've got high blood pressure, I've got the sugars, and I've got fibromyalgia. So they've now turned their whole identity and their whole illness into those labels.
Those labels.
They're not saying I have this. They're saying I am this. And that's a problem. Now they're identifying their entire livelihood and basing their life off of their labels. Same thing I did. I based my whole livelihood off my title as an ER forensic nurse. So I did that and I was like, okay, wait, this has got to stop. Who am I? What makes me me? And that's what that whole shadow work did, is I had to determine, what are my core values? What are my non-negotiables? Am I going to stick by that? And I needed to simplify it kind of, and I hate to say in a black and white way, but it was easier for me to do that. And I totally understand now that you grow in the gray. I had to dip into that gray, and I was avoiding it for so long. So being able to find my core values, and that's one of the things I send to my clients is, before we even work, here's a list of core values, pick like 3 or 5 that resonate with you. And then those will be what your core values are. So if you're met with a challenge, like let's say you want a new job and you go to an interview and you look at their mission statement or their, pillars, and it doesn't align with your core values, then don't go. It's a misalignment. Regardless of the money, don't go. It's a misalignment. You're not going to be happy. So you have to stay true to yourself for 100%. And I think I never did that. So I had to take a step back and say, who am I? What am I about? What am I going to do? And that has helped me shape a lot of decisions going forward.
I think this is great that she used her own experience to help others.
I don't think you could coach someone without having this much experience. I think you need the experience. You need to have gone through it in order to help other people.
She gone through and she fight through it, and then she come out.
Yeah, she come out the other side, and now she's willing to help other people even further.
That is very great concept, great idea.
What do you think is the biggest thing that you're seeing as far as stressed out nurses? Is it like compassion fatigue or guilt or
overworked,
a lack of purpose or overworked?
Overall, that's the entire thing. I think
everything.
The biggest, compassion fatigue is really big. I think the newer generation coming in is doing it for the money, which is not a fault. They still were drawn to this profession for a reason, but I think COVID really pushed people over the edge. Like, they were travel nurses with $10,000 a week. And I said, let's break this down. You're looking at the number. It's $10,000 a week before taxes. It's in New York State, who has 3 different tax tiers. Plus, if your state has an income tax, it's federally funded, which means your tax dollars paid for you to work.
Right.
And then it's not just 3 12-hour shifts. They were working 6 days in a row.
Yeah.
And sometimes 12, 16-hour shifts. And that's not evidence-based to be clinically safe at that point. So you're not safe for yourself or your patient. So you're doing an injustice. So
they're like stay up with no sleep. They're definitely like
that's so dangerous for your health.
Either understaffed or either something gotta
I think nationwide you can only work a 16-hour shift. That's a straight shift, and that's a lot.
Yeah,
that's a lot. But I think some people, the newer generation coming in that I've seen, ill prepared. Plus, we had the COVID nurses who didn't do clinicals, which are hands-on clinicals. They did Sims labs on the computer and press the mouse, like, this is what it should look like.
What's a Sims lab?
So instead of going to clinicals one-to-one, because it was on pandemic, everything was locked down, you watched a video. Like, this is how you would insert an NG tube on this person, and it just shows you ideally how it should be done.
There's dummy.
Yeah.
Well, no, they didn't do the dummy because of COVID. All they did was watch the video. That's what she's saying. They never actually experienced it.
Yeah, if we were in school, we used to do it on the dummy.
Yeah.
And we have to get signed off, and we would do it in clinicals with real people. I think that's one of the problems with healthcare is now we're sick care. It's an oxymoron. But the misconception is we have non-medical people running medicine, and they put in a bubble that everything is a black and white ideal patient. And it's not. Everybody's individual. You can look at somebody and say, oh, this person's going to need this many resources, and that's it. And that's not the case. It's never the case. So then we have to go and document our butt off as to why it wasn't the case and justify what we did, why we did it, to explain why it took so long. Because the question is going to be, why did it take you so long to do this? Rather than, is the patient safe?
Do you think that AI and some of the new technologies are going to help take some of the stress and the load off of a nurse? Or do you see that as replacing certain functions that a nurse has to do? What are your thoughts?
I'm excited to see where it goes because technology in healthcare can be good. It could be a blessing in disguise or it could be a curse. I'm excited to see where it goes. I think if we do the due diligence of thoroughly testing things and really executing them well. Because a lot of times you'll look at something and say, it's a great concept, it's a great theory, but the execution sucked and it failed. I think if we take that time instead of pushing it out very quick, I think it'd be very beneficial and be an asset to us.
What's kind of right now the biggest struggle that nurses have to go through on a daily basis? Is it like dealing with the patients? Is it dealing with the administration? Is it just dealing with the stress and anxiety? What's the biggest issue that people have right now?
It's a great question. I think it's a little individualized because I see certain people struggle with admin, certain people struggle with the patient.
Mm-hmm.
Patients have changed too after COVID. They have really changed.
How have they changed?
The family of the patient also changed.
Yeah, because people couldn't go into the hospital.
That's the worst.
Yeah. It's how do I say this? I think just from what I've seen, I see people become a little bit more dependent on Googling an answer rather than really digging deep and finding the truth. So they're going to believe something over Google that is subjective anyways, because Google search is geared towards the person searches.
And ChatGPT.
Right. Rather than doing the research, because that takes effort. It takes time and somebody doesn't want to do that. So they're going to take it as face value that that's the word and that's it. And people just don't have the time and energy or patience. They want the quick fix. They want it now. They want a shot. They want a pill. They want it over with. And unfortunately, a nurse is supposed to also teach the patient, and we haven't been able to do that. And they're not open to being taught.
Yeah.
They want the quick fix. So if I make a suggestion, if someone's going to ask me a question, I make a suggestion, they've already got 3 rebuttal points. So there's no point in me talking because they're already...
Right. Either that they already research from Google. This is what they're supposed to do. So why am I here?
And it's not as simple as black and white. Like, well, my doctor put me on this and, you're telling me this. I'm like, yeah, so you take a statin and you're not supposed to drink grapefruit juice. Well, the doctor didn't tell me that. It was also in the insert that you're supposed to read. That's a 6 font. That's 5 pages long.
I can't read that stuff anymore. My eyes are gone. I think the fonts are getting smaller too.
I have a friend that on blood pressure medicine, but still eating grapefruit. I said, you're not supposed to do that. Oh, I did not.
Oh, really? For blood pressure?
It's a statin.
It's a statin.
Oh, blood pressure medicine's a statin.
No. Like, it's cholesterol medicine.
Okay.
But like statins in particular, you can't really have grapefruit.
But you can on blood pressure medicine.
Some you can, some you can't.
Yeah.
But they should educate you on that. Typically.
Yeah.
Again, we used to be able to educate patients. We'd have like discharge planning. And I think there's just such a disconnect because I hand a stack of papers to a patient. Here you go. They're not going to read that stack.
No, they don't.
They are not. And they don't want to sit back and listen to you go through the...
They just want to go home.
Yeah. They want...
Robert Kennedy is trying to focus more on a Make America Healthy Again approach and incorporate, which is near and dear to my heart, more natural remedies. Do you see that ever making its way to the ER integrating?
Oh, it's really hard. I personally am woo-woo-y and crunchy as a nurse. I love the holistic aspect. I love natural homeopathic remedies and functional medicine, alternative medicine. I would love to see a merge between Eastern and Western medicine. What I'm experiencing and what I work in, no. Like, it just doesn't happen.
Yeah, it won't support each other. With holistic medicine, you have to be very, very, very consistent. That's another thing.
With holistic medicine, too, it's very individualized therapy, right? Like someone's going to sit there and talk to you and say, what are your symptoms? Let's do these specific tests for you. You go into Western medicine, and it's a recipe, and it's like they're not taught to deviate from that recipe.
Yeah, then always a quick fix. You take a pill.
This is the problem. Here's a solution. And it's like, okay, well, that may be the solution, but what was the root cause? It doesn't matter. Here's the solution. And then that solution caused another problem. And that solution caused another problem. And it's just a domino effect. Again, I'm going to be burned at the stake for this, but it's not healthcare. It's sick care. Sick people make money. We are a business.
It is a business.
Well, I also feel like the doctors are just drug dealers now. I feel like all they do is push one medicine and then that one gives you a problem. And then they have to push another one to fix the problem that the first one gave you.
Yeah.
Listen to your doctors. Listen to what they're saying, because they never say this is going to cure you.
Mm-hmm.
They will never say that. And they'll say, let's try this medicine.
Yeah, they do always say, let's try.
Right. Because it's a black and white, here you go, versus this is specialized for you, individualized. Now they'll say, let's try this. And what do they do? Let's try this for 3 months, see how you do. So you're playing this game.
Yeah, because it might work for me, but it doesn't work for you.
Yeah. So I was in the hospital
Mm-hmm.
and I have an amazing nurse friend that came in and was there for me.
See?
And helped me through the process and was kind of my advocate, because when you're in the hospital, and this is part of the problem with COVID too, you're drugged out. I mean, they gave me morphine for my pain. I was pretty drugged out.
Oh, I love it.
On top of that, I hadn't slept the night before because of the pain.
Uh-huh.
And so she was there for me. And then other nurses came in. Well, she was there just as a friend.
Uh-huh.
And nurses came in and I could tell just from their vibe that they were kind of stressed out. So I cracked some jokes and we had some fun. And I tried to take a little bit of the stress off because, you know, I could tell they were getting beat up in other places. What is the proper way? I don't know if I was appropriate making jokes, but I thought it was kind of fun. But I like to treat people nicely as well. But what is the proper way that people should be treating nurses? Because you guys go through a lot of stuff. And I think it would be great if the in-person, the patient could be more respectful and treat you better. And is it okay for me to crack jokes when I'm in the hospital?
Oh, jokes are great. Yeah, absolutely. But I think this is taboo for me because I'm an ER nurse and I don't have the luxury of getting to know somebody over a long period of time and taking care of them for like days. I'm a very treat them kind of person.
Mm-hmm.
And sometimes I would say, and this is just me being honest, read the room. If your nurse is not really talking to you, don't try to engage with personal questions. And this, again, it's just me. It's just me.
So read the room is what you're saying.
Yeah.
Yes.
Yeah. If your nurse comes in and she looks like she's a little frazzled, don't sit there like, so how many kids do you got? Like, no, we're not going to have this conversation. Yeah. I'm not going to give you any more of myself than the time I'm already giving you. And I know that sounds like the most jerkiest response in the world, but like, I'm here to do a job. I'm here on a mission. Please stop trying to like be my friend.
Mm-hmm.
And I know that sucks. Like,
I think having those boundaries also keeps your sanity. Because at a certain point, if you let everybody in and everybody walk all over you, it would stress you out beyond, and you would leave the profession because you wouldn't be able to keep your sanity if you're taking care of everybody at a deeply emotional level.
Right. We'll go back to that woo-woo and the crunchy stuff. Like, time is a commodity that it's just, you don't have enough of it and you don't have a visual clicker to see how much time is left. And the other thing is energy exchange. I don't want to exchange a lot of my energy and have it sucked away because it's already being like drained to begin with. And physical touch will exchange energy. I don't want that exchange. Like, yes, I'm a nurse. Yes, I'm here to do a job, but like, I'm not here to give you a hug.
Yeah. Well, some lady that go there, they actually need attention. I know for a fact, like personally know person. She constantly in the ER just to get attention from the kid and the grandchildren. Because she said, but once she's in the hospital, they all come see me.
Yeah.
Oh, that's so sad.
Yeah.
It's a misuse of system. And we see it. We'll see it in the ER and we'll try to get case management involved, but we don't have enough staff to deal with people that do that. We've got a gentleman that comes in almost daily.
Yeah.
And he's like, he came in the other day cussing and they're like, oh, Tammy, it's this guy. And he writes people up and he cusses people out. And I'm like, all right, just go. I don't care.
Mm-hmm.
How has corporate, because I know a lot of the hospitals are going corporate. They're like franchises almost.
Yeah, they are big business.
They're big business
money
now.
making
And
now. Yes.
how has that affected the way they treat nurses? And does that add to your client list because of it?
Great question. I think across the board, nurses are very dissatisfied because I don't think it matters if it's corporate or not. You have non-medical people running medicine and making decisions for the medical people. And I think that's a disconnect. I don't know. There's a lot that goes into it. And yes and no, I haven't seen an increase from the nurses that I coach. They're from kind of all over the country, people that I have worked with in the past or people that have referred to me. So I don't I haven't connected those dots yet. That's a great question. I'd have to come back to that.
I don't know.
I think a lot of people transition to other things because they just don't get a good work-life balance. You were mentioning how you go to the gym and you work out and it helps with your stress reduction. How do you coach other nurses that come to your coaching company to maintain that work-life balance? And what do you recommend to help nurses and assist them?
Yeah, it's individualized per person. We kind of dig a little deep and say, like, what kind of are they willing to do? What helps to ground them? I give them some options for grounding that's reasonable to them. Make suggestions. Huge advocate for journaling. A huge advocate for meditation. It's so difficult. Like I remember when I first started meditating, I was like, I'm doing this wrong. What am I doing? I'm just sitting here. I'm almost asleep. What's going on? But after continuing consistency, I found the benefits of it. So if I've tried it and it didn't work for me, it's not going to mean it's not going to work for somebody else. So I have multiple resources to kind of dip my hand into and offer. Again, it's individualized what I think they're going to do. If a nurse comes to me and says, I don't have time to do all this. I work night shift. I can't do this. Like, okay, what if you wake up an hour early and just do a 20-minute walk outside, just get some fresh air, and then just set your phone or your watch for like a mindful moment, which means it'll ding and then you sit there and you just breathe for 1 minute and that's it. Like breathing helps reset your vagus nerve.
Yeah. So you have more of a holistic approach to taking care of the whole person, and it's got a balance of, clinical and education things like systematic approaches to healing and stress reduction, and then, more natural wellness areas as well.
Take a walk, take a deep breath.
Yeah.
So I know my yoga instructor actually go from hospital to hospital, teach yoga.
Does she?
Yeah.
Oh, wow.
Yeah,
that's a good source. Yeah.
I worked at a hospital in California that had
this is in California.
like a wellness kind of room, mindfulness room, where it was just a room that had like a recliner in it and the salt lamps and misted lavender. And it was a place where you can go and just have that personal moment for as much time as you needed. But it was there at work. A lot of the hospitals I worked at in California also they had a gym that was for like cardiac rehab or whatever with PT, and they let the nurses use it at night. It was free gym for them. So all these little amenities that your hospital is willing to offer you. One was a union hospital and one wasn't. So it just didn't matter. I think it was a great culture that they had across the board. And one was Northern California, one was Southern, but they'd had this shared thought process to like really have the nurses have a balance at work and have a release. And one thing I practice is I have a damn it doll. Love this thing. You basically take the doll and you hold it by the feet and you just hit it against the counter. So I bring that to work with me and I keep it on my desk.
Doll.
I just got to let it out. I keep it on my desk and it's open to anybody that wants to come by and just like slam it. And I know it may look horrible to like a patient or a family member. They can take it around the corner and use it if they want to, but it gives them a release.
You got to let the anger out.
Yeah. And I'm a firm believer in that. And anyone who's gone to therapy probably had a therapist say like, oh, get one of those pool noodles and hit the couch, or get a tennis racket and hit your bed. It's a way of getting it out. And I'm such a huge fan of rage rooms. If you don't know what that is, it's a room that's like set up just so you can go and break stuff. Love it. It's so cathartic, and I advocate anybody to go. Yeah.
I know you said you're not a therapist. But I think coaching kind of crosses the boundaries once in a while, because you feel like when you have a client that you're helping them through and coaching them through a lot of stressful times. So can you speak to that a little bit?
Yeah, usually traditional therapy likes to deal with like getting to the root cause and dealing with the past and resolving the past. Coaching is more like, let's look at the problem, the root cause, but let's go forward from the problem rather than trying to fix that past. I think it's a fine line, but it's mitigating the patterns and the problems.
So to focus on, find out what the root cause, focus what it does, and then move on how to the solution. That's what coaching is.
When someone's stressed out and they're not burned out yet, but they're coming up, like, when is a good time for someone to come and hire you and your services? Do you work with people progressively, like prior to their burnout, or is it till they get to a point where they're breaking? When's the best time for them to come and use you?
Anytime I meet people where they're at. But anytime they can come to me, and again, we'll do a kind of a screening. We'll do a discovery call and a screening. And the screening is just 3 questions. It's a pre-coaching questionnaire. And my reason to do that is to let them know this is kind of what you should look forward to. And I hate to use the word expectation because expectation has you have an expectation and a downfall.
Mm-hmm. What I'm saying is, I think don't wait till you get to your breaking point. When you start stress, you should reach out already, no?
Well, it's a cost, right?
Help. Yeah. It's hard to ask for help too, because think about these kind of people, they're very proud.
Yeah.
One of the biggest common patterns is ego. And I had it 110%.
Yeah.
I was probably one of the loudest people in the room. I was constantly talking, over explaining myself. I'm pretty sure that people that have healed and done the work that I did before I was there looked at me and was like, you poor girl.
Yeah.
I've been where you're at, so I'm going to give you some grace, but you're so wrong.
Yeah.
And I was so ignorant to that because I was very egocentric. Very egocentric. And there's a lot of ego, especially in emergency medicine. Not everyone I coach is from emergency medicine. They are from different parts of nursing. I've coached somebody who was not a nurse. I think she was a real estate agent, and she wanted to go into the medical field. So she was transitioning from real estate agent to radiology. So yeah, she's one of my favorite clients. I actually learned a lot from her just by coaching her, which was really great.
That's brilliant.
So yeah, it was really a beautiful type of relationship for that.
My thing is, if your job stress you that much, then reach out for help. Maybe you find an alternate way to make a living.
And you can't get this paid for by any organizations or companies don't pay for any type of mental health assistance or coaching, do they?
No, not yet. I mean, there's some coaches that I went through the collective with that have that kind of corporate standard. I've actually done a whole presentation proposal to my boss to incorporate what I do because I'm board certified. So I'm a board certified nurse coach. And I've did a whole proposal and I gave it to my director and she's like, oh, this is great, but we don't do this. I'm like, okay, great. And then I
don't
also
have budget for it.
Well, I worked in a lot of metric for corporates. They can see this is what I'm going to be measuring to see whether this is a payoff for you. And then I also tweaked it and gave it to my CNO and she was just like, yeah, this is great. Sorry. So it wasn't received very well, but you know what? I'm going to just keep going so I can go to other places and offer services.
Right.
Some of my cohorts use insurance. I have not done that yet. I don't think I will. I think I'll just do cash pay or whatever pay. I don't want to go through insurance. It's a lot of red tape with insurance.
Yeah. The company I used to work for, they actually have the whole department for that. So we have 4 ladies there. It's like a gym, but it's called wellness room. And the company pay for it. But you know what? When the company got bought off, those ladies was the first person who got let go. That's how much they don't believe in that.
Yeah. Some companies believe in it. Traditional companies will believe. And my mindset when I was in business was your first customer is your employee.
Yeah.
And I've always kept that mindset.
Yeah.
I don't see that in businesses today. Yeah.
It's sad that we don't focus more on mental health in this country because when you don't have mental health, you don't have any health.
Yeah.
And mental health should be the very first health you work on. There's mental health, there's physical health. Mental and physical, they tie together. And sexual health and spiritual health, there's health across the board. But if you don't have mental health, you can't even get to the other levels.
Yeah.
So it's sad that they don't put more money into it. And I think a lot of disease is caused because of a lack of mental health as well.
I think it starts from there.
Yeah.
But with corporate,
that's a whole nother ball game. I can go down that rabbit hole real quick about how the disconnect and dysregulation can cause disorders like autoimmune disorders, but that's a whole nother subject.
Yeah.
So,
something always triggers those things, doesn't it?
It is.
So what is your favorite if somebody's stressed out and they're not to the burnout level yet, so they may not hire you yet, but they're just beginning. What is your favorite self-care ritual right now that someone could do to help just kind of let the stress go?
I'm a big fan on breathing exercises, but again, you have to get the feel of what your client is willing to do. Some moms need just a minute to breathe.
And
So a lot of nurses, a lot of medical professionals are balancing being a parent and probably the sole provider, if not like one of the providers. So a lot of nurses that have children, they need just that minute, like the mommy moment or whatnot. So I'm like, hey, is there any way you can get a sitter for this, like just for an hour? Just go get yourself a coffee. Like self-care is not selfish, and just kind of reassure them like that they're not alone.
Mm-hmm.
We are the worst to ask for help. We are the last people to even want to be seen as vulnerable. So we don't want to ask for help. It's listening to what their needs are and saying, make a suggestion. Like, can you take a minute to have a coffee? Can you go outside and breathe? Can you ground yourself real quick? Like stick your bare feet in the grass. Can you journal for 30 minutes? Can you just set a timer and journal for 30 minutes? Just like word vomit on the page and get it out. I'm a huge proponent of better out than in. I think the theme is just the little stillness, like mindfulness and stillness is a big theme. Like they have to have their personal time.
Yeah. I'm a believer on the stillness. Every morning I do my 15-minute stillness.
I try to meditate, but I lay in bed and I think, and I fall right back to sleep.
Yeah. It's the beauty is it's not for everybody, right?
Yeah.
Like there's so many different modalities that you have a way of trying these different modalities and what works for you.
Yeah.
I couldn't do self-meditation, so I have a brain tap headset that is guided meditation, and I do that every morning.
Yeah.
Then I do my little rituals, like I'm going to get up, I'm going to wash my face, I'm going to brush my teeth. Right.
Lovely.
And you're just sometimes you become emotionally numb and you shut down, and the dysregulation is really big. It's huge. And you don't recognize that until you stop and take a look back.
Look at that.
If you're reevaluating your life and you're like, well, this happened, and you can honestly say, what's the common denominator, and say it's me, that is like the biggest hard truth you'll ever face. Like, I may be the drama here. And then once you recognize it and you accept it, then you work on it.
I'm a true believer on. I wish I'd done sooner. Then I started yoga, the yoga and the breathing. So I just started it like 7 years ago. And I blame on like, I work too much. I don't have time for this. But you do have that half an hour every morning.
Yeah. I truly believe if you don't make the time now, you're going to be forced to take the time later. And that's just, I see it every single day in the year. Every single day I'll have a client come in like, oh, blood pressure's 200 over 120. And like, my heart feels kind of funny. It was running kind of fast. Well, today's Saturday. It happened on Tuesday. So for 6 days, you've had this issue. Yeah. Why did you wait? Well, I thought it would stop. I didn't want to come in. I had work to do. There's always an excuse. So, you can have results or you can have excuses. And I get it. We're stubborn. We're all stubborn. And I live that little nugget. Like, if you don't make the time for your health, you're going to be forced to take it. And right now you're taking that time. So what are you taking away from today? You took away from your family. You've got your wife sitting here who's taken away her time, but she's been telling you for 3 days to come in when you finally told her something was wrong. But in that meantime, it added up that you're in a bad rhythm, and that rhythm can cause a blood clot, and that blood clot can kill you. Well, they don't want to hear that. So they're like, oh, that's not going to happen.
So same goes with the nurse that get burnt out.
Right.
I always say excuses are justification for laziness. That's really all it is. And if you think about even excuses we tell ourselves, if you have, I haven't lost weight because I just don't have the time, that's a justification for laziness.
Right.
If you have an excuse, my mother was fat, therefore I have to be fat too, that's a justification for laziness. I think we allow a lot of times our laziness to interfere with our health and our mental health too. I don't want to go see a therapist or get a coach because I'm justifying my laziness. If something's important to you, you just have to do it.
Right. So
there's that conscious effort though. You got tired of it and you made that conscious effort. I'm going to do something about it. And people sit in this pre-contemplating phase. Like, I know I need to do this. I know I need to do that. Oh my God, I want this so bad. For years, you go from pre-contemplation to contemplation is the action.
Yeah.
It takes bravery to take the action because you're actually doing something, but whatever it was that inspired you to do it kicked in.
Yeah, for me, it kicked my nerve when my blood pressure goes up. I'm borderline diabetic.
Oh, wow.
Yeah, I have like the cabinet medicine full of stuff.
I'm anxious. I'm going to take a pill. Oh, I can't sleep. I've got insomnia. I'm going to take a pill. And I trusted my doctors. I trusted my providers. and unfortunately, I've got like insomnia, I've got anxiety, now I've got depression, now I've got panic attacks. And I'm like, okay, what am I doing here that I'm just putting a Band-Aid over a bullet hole? Let me get to the root cause. And when I moved here, I made the conscious effort, like, I'm going to cut out all pharmaceuticals. I'm going to do things as natural as possible. I'm on that road to, I'm going to be diabetic. I'm going to have high blood pressure. I'm going to have cholesterol. And I'm probably going to have an autoimmune just because I've been inflamed for so long. So I had to make a conscious effort to stop all that. So it took me about a year to wean off like anxiety medicine and depression medicine, which is very synonymous with medical professionals. We'll all talk about, I'm on my Xannies. I got my wellies.
Oh, wow.
Yeah. It's like common, like how much Xanax are you on? Okay. And what kind of welly do you take? Do you take your welly with Lexapro?
What's a welly?
Wellbutrin.
I don't even know what that is.
It's an anxiety and depression medicine.
I'm so anti-medicine. I don't even know what half these medicines are.
Yeah.
Oh, I love medicine, but after a while...
She's a pill popper.
Yeah. After a while, it caught on to you.
Yeah. I mean, you build a resistance to it and a tolerance to it. So I had to go off of those. And with that, I'm like, what can I do in lieu of that? So I looked up natural homeopathic ways, like vitamin supplements. And then again, a whole nother ball game of different types of vitamin supplements. So now, rather than taking prescription medicines, I take cycles of ashwagandha. I take Max glycinate to sleep. For like clarity, I'll do like mag-threonate and then probably some taurine. So I do the homeopathic on that. And then I cut out like preservatives and dyes from my diet and I meal prep. I certainly got off that path when I started a job at a level 1 trauma center down. That kicked my butt. And again, it was just going back to habits of like, I'm stressed, let me eat. I'm such a feelings eater kind of person. Man, I eat my feelings like nobody's business. But it was give and take. So the habits I've kept since moving here for the past 3 years is staying off the prescriptions, cleaner eating, meal prepping, and just being as wholesome with food as possible, like not doing the processed. I cheat. I'm not going to lie. I'm a human being. If I get stressed at work, I'll order something. But
fried chicken always help.
No, it does not. Made with seed oils. It's terrible for you.
Fried chicken and ramen.
No. Extra carbs. No.
It's a comfort food, ramen. I was craving that the other day.
Yeah.
I talked myself out of it. I was craving it. I think I'd watched a couple TikToks that had it on. I'm like, damn it, now I want ramen noodle. But yeah.
Do you have any like mantras or affirmations that you say to yourself in the mirror or anything that helps you get through when you have stressful situations?
For me, this is very personal. My biggest one is I'm worthy. And that goes way back to deep-seated childhood trauma. But my biggest thing is I am worthy. And some of the things I always pass in my mind is they don't know what they don't know. That keeps me from being wicked judgmental. They don't know what they don't know. And just give them grace and then give myself grace. I'm my hardest critic.
Well, I think the journey that you've taken from your childhood on to now has made you the perfect coach because you've been through the shit. It's if you've been through the shit, then you know from beginning to end how to help people survive it. And that's the only way is going through the shit. I like the word shit a lot. And once you get through that, now you have the ability to pull people up with you and take them with you.
Yeah.
I hope so. I like to think that I'm able to help people that can't help themselves or who don't know any better.
Yeah.
When I was in college, one of my sorority sisters experienced a very tough situation that majority of women find themselves in. And that prompted me to do public speaking so that I could basically tell my story to help her and anybody else that experienced something about that with sexual assault and sexual abuse. And that lit a fire. I was very passionate about public speaking. And I think that helped me become the sexual assault nurse examiner and specialize in that. And with that, I was able to help train unit victim advocates when they deployed overseas for the military. Spoke to graduate nurses on what a forensic nurse is and how to treat patients when they come into emergency room. I've had a lot of platforms for speaking on that. My hope, my goal is to have a thriving coaching practice And in turn, I want to be able to give back to survivors of people that have been abused sexually or trafficked to help coach them to come out of it a little bit easier.
So you're going to add to your coaching business and now coach people that have gone through rape or molestation or been sexually trafficked in the future?
That would be a pro bono for them. That would be like my way of giving back to the community, is to help survivors.
That's amazing.
That's amazing.
Especially now.
Yeah. Even though just to help with veterans that just come back from the war. You know how many of them that on
PTSD.
Yeah.
Well, the therapy would help that, but then she can coach them into their future.
To forward.
Mm-hmm.
Yes.
I used to work in a military base, and I have a lot of military friends that have now retired, but I've spoken to them about the brain tapping.
Yeah.
Again, it's a headset for guided meditation. I'm not a spokesperson. But it's helped me tremendously. It's helped to like calm me down.
Mm-hmm.
It's helped me to have perspective. It's helped me to sleep better at night. I don't have to take melatonin or sleeping pills to sleep at night like I used to.
Mm-hmm.
And sleep is so important to heal.
Yeah.
Sleep is very important.
I will tell you, if I don't get enough sleep, nothing's happening that day.
Me too.
I will try and I'll struggle through, but I will not be at my best.
If I miss my nap and I'm cranky by dinner time.
I can't work out hard. Like if I don't sleep well at night, my gym routine suffers and I'm all inflamed. I can't do it. I mean, I'll do it, but I begrudgingly do it. I think sleep is so underrated.
Yeah. Sleep is very important.
Mm-hmm.
Everyone needs 8 hours sleep.
So if somebody wants to reach out to you, what's the best way for them to contact you as far as getting in touch with you to hire your services?
Through my website is the most direct way, possibly, or like I post daily on Facebook and Instagram, and they can just reach out and direct message
And your website is?
www.northstarnursecoaching.com.
Gotcha. So how long, and I know you can't really put a number on it specifically, but typically when somebody comes in, how many sessions do they go through with you in order to grow and to heal into the next steps?
Sure. So we have like packages. I do a 3-month and a 6-month package. The 3-month is guaranteed at least an hour every week, 1-to-1.
Oh, wow.
Yeah, 1-to-1, an hour every week. And then also it's whatever they are interested in. Again, when we get together and we work on that, like if they want homework or goals, then I would come up with tasks for them to do.
Yours is more of a one-on-one, and I get that.
Yeah.
So going forward, do you see this hiring other coaches under your systems, or do you think this is still going to be a one-on-one type of program?
Ooh, good question.
I could be your patient coordinator if you're hiring.
She wants a job.
I need a job.
I think right now it's 1-to-1. If it were to grow, I refer people out to other coaches, like people that I've gone through the collective with my coaching practice, when the training, there's specific women that specialize in menopause health, and these are all nurses. We're all nurses. There's one in particular is a gentleman. He's a nurse, but he specializes in military coming back with PTSD, and he's drawn to helping military with that. And he's very much based on his Christian faith as well. So evidence-based nursing practice and Christian faith. So he does that, and I would refer them to him. So it's we have a good network already. I don't think we need to have.
So it's based on how busy you are, basically.
Yeah.
So have you ever turned people down just because you didn't like them?
I wouldn't say I didn't like him. It wasn't a good fit.
Okay.
This is kind of the expectation that we're going to go forward with. If you're not going to do the work, then we can't work together.
Right.
Not the magic pill, not the magic fix. You're going to have to actually do the work.
Right.
Yeah.
Yeah, that's one thing that they have to understand. Coaching is just guidance them. They have to be the one who do the work.
Yeah.
Right.
I've had coaches and I've been a coach. And I will say, I don't have a lot of patience for the people that don't want to step up and perform when they say that's what they want.
Right.
And the lack of consistency with them actually devoting their time to what they say they want drives me nuts.
Right.
So that's why I don't want to be a coach. I admire coaches, and I think they do a great thing.
They do, but people need to realize it's consistency.
It's consistency. And I think that we are so capable as a human species, and I know this is a little awkward. We do not use our mental capacity the way we should. We do not grow in the way we should. We do not.
No, we've gotten too complacent as a society.
Lazy. Completely lazy. And I think going forward, if people could just take a breath, take a step back, analyze where they're at, because we need to evolve as a species. And I don't think we're evolving because we're going backwards in several areas.
Yeah.
Because of the ease of living.
Yeah.
And I don't think people realize that you really need to learn to control your thoughts and your mind to grow as a person, because that's the only thing in this life you actually have control over. You don't control other people. You don't control the weather. You don't control traffic, but you do control your mind and how you react to situations.
And I can attest that I sat on this cruise control of so long of being numb and in that fight or flight constantly, but I also was emotionally reactive. And that's what really caught my attention. Is like, I need to not be like, people have triggers. Everyone has a trigger. But I found that how I was reacting to them was emotionally irresponsible. And I was like, okay, I need to cut. Like, this is, I'm responsible for myself. I can't keep blaming other people for my actions. And that's the hard truth. And some people can't accept that truth, and it's called accountability. And some people can't do that. And you'll have people come like, yeah, okay, so my wife says I need to be coached. So I'm reaching out because like, I liked what you said. And like, you're going to help me. I'm going to help you help yourself.
Right.
So I'm going to help you recognize your patterns. And then we're going to try to like rebuild and make constructive, like good decisions that are evidence-based that can help you individually. And if you're not able to do that, then we'll just part ways and I'll refund your money.
Yeah.
Yeah. Well, is there anything else you want to add to your program, how you help women, or anything related to your business that you would like to add at this point?
No, I think we've covered a lot. And I appreciate the platform. Thank you very much.
Well, Diva Tammy, we all respect, because what you do is a struggle every day, and we respect that.
Yeah. I think most of people, not just the nurses, they could relate to that.
They can.
Yeah, at some point, you know.
Well, this is Diva Mia. I think we're going to wrap it up now.
Yeah, that's all I have. Do you have anything else?
No, I'm good. So this is Diva Mia signing off.
Diva Tax, talk to you soon.
Thank you for having me, guys.
All right. Have a great day, everybody. Ciao, ciao.
Ciao.
Thanks for tuning in. Like, subscribe, and drop a comment. We'd love hearing from you. Visit thedivadetails.com to connect. See you next week for more.
Diva Details podcast and website are intended solely for informational and entertainment purposes. The content provided does not constitute professional, medical, financial, or legal advice. We are not licensed medical practitioners, financial advisors, or legal professionals. Always consult with a qualified healthcare provider for medical advice, diagnosis, or treatment. Any financial topics discussed are based on personal opinions and experience and should not be considered professional advice. The content provided does not constitute legal advice. The Diva Details and its affiliate contributors and guests are not liable for any losses or damages arising from the use of our content. The opinions expressed in the podcast are solely those of the speakers and do not necessarily reflect the views of any affiliated organization, sponsors, or partner. All facts discussed in the podcast are researched and accurate to the best of our knowledge at the time of recording. Information may change over time. No guarantees are made regarding the accuracy, completeness, or reliability of any statements or opinions presented. It is the responsibility of the listener to verify any and all facts that may influence their decision. This podcast is for information and entertainment purposes only and should not be considered professional advice.